In this orthokeratology case, we have a patient who's got axis 90 cylinder in the post-treatment refraction. And if we look at the quad view here, we can see that there's about a diopter and a half of lithoral toricity on this cornea, but very little of cylinder in the refraction. So what this says is there's a decent amount of internal astigmatism that's against the rule. I think what's happening is with this lens, we are molding out this corneal toricity really well, maybe a little bit better than we had expected it to be molded out. And so that just reveals 100% of the internal cylinder, and that will give the patient reduced vision because we've introduced a new component to the refraction. So what I would recommend doing in this case is reducing sagittal depth here in the vertical meridian. Oftentimes we're increasing sagittal depth to address corneal toricity that's not being molded out well enough. But in this case, we're going to do the opposite. So in 50% mode, in the vertical meridian, what I would do is lift here about 15 microns, which means we would end up with a sag of 845. And because we're in freeform, we're going to have to do the same thing in the inferior meridian. Our target here is going to be 842. So what this will do is reduce the seal here in the vertical meridian, and that should give us less molding in this meridian, which means we'll be left with more of this toricity, which we want to retain on the cornea because we want that to counteract the internal astigmatism. And then the final thing I would do here is uncheck the blend box and go ahead and turn the blending back on. There is a little bit of decentration to the lens, and I find that decentration seems to be more prevalent when the blend box is checked. So I like to leave it unchecked in most ortho-K cases. And hopefully this will alter the shape of the treated cornea and help your patient see a little bit better. So best of luck with your patient.